I'm Marianne Mason, Associate Professor of Emergency Medicine at Northwestern University and Principal Investigator for the statewide unintentional drug overdose reporting system in Illinois. I'd like to talk for a few minutes about opioid overdose deaths in Illinois during the time of COVID. Unfortunately, the news isn't good. There have been reported upticks in overdose deaths in Illinois, both in Cook County and in a number of other counties within the state. While we don't know for certain, we believe that these overdose death increases are due in part to self-isolation due to COVID-19, lack of access to naloxone during self-isolation, and also lack of access to drugs, which then reduce tolerance and put people at risk for overdose once they resume using drugs. The panelists today will talk about aspects of the drug overdose problem in specific Illinois counties and connect to resources for naloxone distribution.
My name is Ed Boone. I'm Community Programs Coordinator with SUDORS, servicing some of the northern suburbs such as Waukegan, some of those over in Lake County, Round Lake, and also in the southern south suburbs, Markham, Harvey, but mostly in the city of Chicago, working with a lot of community-based organizations and coalitions who at this particular time are not only addressing COVID-19 and the opioid addictions in the community. Some of those coalitions that I work with are using the heat maps are using them to identify areas of high drug overdoses in order to deploy resources in those areas and outreach. There is some outreach still going on. They're going into the hot spots and they're distributing not only, they're doing abbreviated trainings on the spot, like a 15-minute naloxone training, 15, 20 minutes, real quick. They'll provide kits, PPE masks, and they move along. In terms of resources and funding, they're looking across the state to identify funding resources and taking advantage of them. A lot of them are collaborating with each other. There's the West Side Opioid Task Force, which was convened by State Representative LaShawn Ford, and they've brought over 50 organizations together, and they meet monthly. They've been doing it virtually now to talk about distribution resources, and they have a different focus every meeting. Well, they have a different organization or trainer come in to talk not only about resources, but about prevention efforts. And so there's a lot happening in the city. And as I say, at this time, this current moment, there's a lot going on with the increase in violence. And it just puts a strain on organizations when they have all of these priority issues, the violence, the COVID-19, and the overdose that's going on in communities. And it puts a strains on their resources and their staff because they're losing funding, and then maybe some have to lay off staff. So they're constantly seeking resources. And I'm available. If anyone wants to reach out to me, we can talk about block by block training and how that's being used along with the heat maps or any other support that I can provide you.
Sure. So since January of this year, we're dealing with the increased caseload due to the COVID pandemic and all the increase in the numbers. Like, for example, right now we're a little over 9,300 cases. And, the whole of last year, we just had 6,200 cases or so. So, we were looking at just COVID-19 and the increase in caseload because of that. Little did we realize that not all the increase is just due to the COVID deaths. We looked at the data a little closely and noticed that there was a tremendous increase in the number of opioid deaths in Cook County. So I checked today, we had 800 confirmed opioid deaths so far in 2020. The whole of last year, we had 1,267 opioid deaths. Now, this 800 opioid deaths this year does not tell the whole story, meaning that we do have pending cases that are waiting toxicology results, waiting for the doctor to look at the results, look at the case and determine the cause of death. We have 600 of those. And usually out of these 600, 70 to 80% of them end up as opioid deaths. So we're looking at an additional around 420 to 480 cases in addition to the 800 confirmed cases. So that brings us to more than 1,200 opioid deaths in Cook County so far, which is more than the total number of opioid cases last year. And last year, we noticed that there was an increase in the number of opioid deaths in the Black non-Hispanic population. And this year so far too, we see 63% of the confirmed opioid deaths in the Black and some of it in the Latino community, but mostly in the Black community. And when we worked with our GIS or the Bureau of Technology, who actually create a map that shows where these deaths are occurring. And most of this is in West Chicago. So that includes Austin, East Garfield Park, and West Garfield Park neighborhoods. And looking at the drug, the opioid, the actual opioid involved, most of it is fentanyl. Long time ago, we were seeing different fentanyl analogs, but now it is fentanyl. It is always usually mixed with another drug like heroin. We see sometimes it's being mixed with cocaine, but it is, if you look at an individual drug that is most often seen, it is fentanyl. It is still primarily Black men. The age group still continues to be the 45 to 54-year-old age group. So we think most of this increase may be because people are staying at home more. The stay-at-home order was issued. So there may be a hesitancy with people going to emergency rooms. We did have a conference recently with the Director of Emergency Medicine and Toxicology at Cook County Hospital. And he was saying that the number of emergency care visits are much lower now compared to before COVID. It could be because people are not going in for help, could be one of the reasons. There is more, people are a bit more depressed or stressed out with the COVID. That could be a reason that they're abusing opioids more. We can provide the data, but just actually looking at why we're seeing the increase, I would look at public health and epidemiology for some assistance with that. So other than we're seeing this increase, and I think everyone needs to understand that we're seeing a huge increase, and we need to look at ways in which we could reduce the number of deaths or the number of overdose incidents that lead to that may need maybe help at hospitals, or what Ed was saying, we need people to look out for help. It is there. And I think by what you're doing, just spreading the word that there is help available, I think is a huge step.
My name's Lee Rush. I work with Prevention Partnership, and Prevention Partnership is the coordinating agency for the West Side Heroin Opioid Task Force. I'm the director of the task force. There is a group that's associated with the Prevention Partnership and the task force. It's a 6-person outreach team that's headed up by the outreach director for the task force, Luther Sias. And there's 3 men and 3 women that have been working continuously, going to hotspots and areas in the West Side where people are either buying drugs, using them, both, etc., and providing street level training on how to recognize an overdose, and also how to respond through the injectable naloxone, which is the antidote for opioid overdose, and also giving out the nasal spray, which is the brand name of Narcan. They both work the same. A lot of folks do know how it's used, but we make sure that we get them to refresh their, tell us what they know and refresh their memory. Since the 10th of March, that group has trained 1,100 individuals and given out 2 doses each to those 1,100 people. Some of them have gotten re-upped. We've also been giving out information about where to get treatment and other kind of health issues. Probably about 4 months ago, some organizations, CDPH, Chicago Department of Public Health, was generously donated a lot of PPE, hand sanitizer, gloves, masks, etc., that has enhanced our ability to work with people. And actually, since near the end of May, we've been doing a new model. The outreach team has been working with folks from Thresholds, which is a treatment program and housing program. That's this particular office is in the 11th district off of Pulaski. We've connected with them, Night Ministries, and other providers. So when these folks go out to the hotspots, they actually have a full range of services that are being delivered. The Thresholds also does training in the naloxone and distribution of naloxone, but they also do referral to managed, medical stabilization units or detox, and all the way to getting folks into treatment. And Night Ministry does a variety of things in addition to their work as doing first aid, and but they also have a notary public that actually can, if people are, you need to have their papers together so that they can get into treatment or get into housing lists, et cetera, et cetera. So it's a new model that's been, we're really kind of talking about almost a rapid response type of piece, where we, if I may digress, this happened after, on May 30th, Thresholds went out with the outreach team. And first of all, they were just amazed by the amount of people that were out there in need, which prompted us to say, hey, when next time we go out, let's make sure that we have somebody manning the phones, almost like a hotline, available to us for the 2 or 3 hours that we're out, so that when we call, there's a rapid response. So we've now developed basically a warm handoff from the street to the medical stabilization units at both Miles Square and St. Anthony's, so that people, we have a phone number, and for the most part, they can get transportation out to us so that we can get somebody into treatment. That's a huge piece. We believe that it's replicable, it's scalable, and we really feel that this should be happening all over the West Side. You know, the current situation is that the amount of overdoses and deaths due to overdoses have been skyrocketing over the last 6-7 months, since COVID especially. And we really realize that this is really a scale of almost like a catastrophe, and we need to have a response to it that's in the scale that's there. And 6 people or 10 people or 12 people out there going to one spot on the West Side and all those communities just doesn't cut it. We need to have folks out there. This outreach team has actually gone to about 162 different spots over the last summer of 2019. It's not, the issues are not confined to one location as they might be in some cities where there's a specific spot where all the people who use go. It's all through the whole, the West Side, and we need people, and we need a response that is commiserate with that kind of need. But I can't stress enough about how we really need to up this response. If it was up to me to write the plan, we would probably have a crisis manager specifically focused right on the West Side, bringing all the different resources together. as I like to talk about it, it's kind of like a slow-moving Katrina, just kind of sitting right over the west side. And there's people metaphorically up on the rooftops and the water's rising. And we need somebody that knows how to get the boats out to people and get them off that roof. And so we don't have that coordinated. The task force, we haven't been really tasked with being that group. And quite understandably, everybody that's a member of the task force, even the organizations, the not-for-profits, they're basically trying to fight the same fight. Anyway, that's kind of the overview of what's going on out there. We have great partners. We're always trying to find new ways to collaborate. And we really believe this multi-organizational type of approach, street approach, is the way to go. And I should mention that, you know, Chicago Recovery Alliance is still being out there with their vans on their regular schedules. They're back at kind of full strength in terms of what they're doing. And we're eager to find other folks who are doing street level work. And if they point out areas where they have some concerns, we can mobilize and get people over to get some information out